Good day, everyone. My name is Florence Siregar. I am an English literature student at University of Sumatera Utara. In this video, I will talking about neurolinguistics. So there are three main points or contents that I will talk about. The first one is about introduction. It is consists of definition of neurolinguistic and human brain. And the second one is about discussion. It is consists of about aphasia, especially about my case. It is broadcast aphasia, and the last one is about conclusion. It is consists of what is the treatment about broadcast aphasia. Getting into introduction, let's talk what is neurolinguistic. Neurolinguistic is the study of how language is represented in the brain, that is how and where our brains store our knowledge of the language that we speak, understand, read, and write, what happens in our brains as we acquire that knowledge, and what happens as we use it in our everyday lives. So it is related to human brain. Talking about human brain has two hemispheres, right hemisphere and left hemisphere. Both sides of brain play different roles. Right hemisphere involves music, fantasy, literature, intuition, painting, and understanding of saddening experiences. This hemisphere is able to use the language well by giving the intonation, stressing the other tones, using gesture, hand movement, and facial expression as the way to make listener deeply understand the thought and feeling that have been expressed. Right hemisphere was known as the part that functions and knows others' behavior. By having this kind of ability, someone will be able to arrange and use the utterances according to the particular occasion and time, while left hemisphere manage the process, such as language, logic, mathematics, writing, and understanding of the pleasant experiences. The linguistic specialty is located on the left hemisphere of brain. This hemisphere functions in monitoring the grammar ability, understanding the other's utterances, naming object, repeating something, reading, and writing. Move to the next slide. It is discussion. The case that I took is broadcast aphasia, but first of all, let's know what is aphasia. Aphasia is a loss of the ability to produce and or comprehend language caused by damage to brain areas specialized for this function. The types of aphasia are broadcast aphasia, Wernicke's aphasia, pure word deafness aphasia, conduction aphasia, anomic aphasia, aphasia, global aphasia, and aphasia reading and writing or non-dysclasia. And the case that I took is broadcast aphasia. Broadcast aphasia is a form of aphasia in which the person knows what they want to say, but it is unable to produce the words or sentence. It is also known as non-fluent aphasia and expressive aphasia. And severity can range from mild to severe. People with broadcast aphasia are typically aware of their communication difficulties. Broadcast aphasia is due to damage to broadcast area in the left hemisphere of the brain. Broadcast aphasia is often described as having the words on the tip of your tongue. It is called non-fluent aphasia because speech is effortful and involves starts and stops. Another defining feature is that if sentences are produced, they often have incorrect syntax or word order and grammar. Comprehension and reading and listening are less affected than speech and writing expression. Simple sentences are easiest to understand. For instance, John likes ice cream is easier to understand than ice cream is a food that is liked by John. People with broadcast aphasia are often able to understand most of what is said to them, but they have trouble responding. Someone with broadcast aphasia can also experience less obvious communication impairments. Sign and symptom of broadcast aphasia. As we know, broadcast aphasia is a type of non-fluent aphasia in which an individual's speech is halting and effortful. Misarticulation or distortion of consonant and vowel, namely phonetic dissolution, are common. Individuals with broadcast aphasia may only produce single word or words in a group of 2 or 3. Long pauses between words are common, and multisyllabic words may be produced one syllable at a time with pauses between each syllable. The prosody of a person with broadcast aphasia is compromised by shortened length of utterances and the presence of celery pairs and disfluencies. Intonation and stress patterns are also deficient. For example, in the following passage, a patient with broadcast aphasia is trying to explain how he came to the hospital for dental surgery, but he saying is on Monday that Peter hospital Wednesday 9 o'clock or Thursday. The speech of a person with broadcast aphasia mostly contains words such as noun, verbs, and some adjective. However, function words like conjunction, article, and preposition are rarely used, except for and, which is prevalent in the speech of most patients with aphasia. The omission of function words make the present speech agrammatic. In general, word comprehension is preserved, allowing patients to have a functional received language skill. Individuals with broadcast aphasia understand most of the everyday conversation around them, but the higher level deficit in received language can occur because comprehension is substantially impaired for more complex sentences. It is better to use simple language when speaking with individuals with broadcast aphasia. This is implied by difficulty to understand phrases or sentences with unusual structure. Typically, people with broadcast aphasia can understand speech and read better than they can produce speech and write. The person's writing will resemble their speech and will be effortful, lacking cohesion, and containing most content words. Letters will likely be formed clumsily and distorted, and some may even be omitted. For the causes of broadcast aphasia is caused by a stroke in broadcast area or the surrounding vicinity. Broca's area is in the lower part of the premotor cortex in the language dominant hemisphere and is responsible for planning motor speech movement. For conclusion, currently there is no standard treatment for Broca's aphasia. Most aphasia treatment is individualized based on patient's condition and needs as assessed by speech-language pathologists. Patients go through a period of spontaneous recovery following brain injury, which they regain a great deal of language function. Rehabilitation with a speech pathologist involves exercise in reading, exercise in writing, exercise in flowing direction, repetition of what they hear, and computer-aided therapy. I think that's all from my presentation. Hope it useful and see you next time.